Time for today's GBMC RX prescription for a healthier you. And now that the weather is cooperating, it's time to talk about summer safety. Christopher Toth is with GBMC Health Partners Primary Care, Jarrettsville. Welcome.
Thank you for having me.
Happy to have you here. So, despite all the warnings, people love spending time in the sun. So, what are the top recommendations that you have for protecting our skin?
For sure. So for general sun safety, we should focus on a few things. First, we can utilize UV protective clothing that is safe for all ages, okay, from infants all the way through adults. UV protective clothing tends to be on the cooler side. It tends to be lighter. It tends to be more comfortable in the summertime.
Okay.
So very helpful, highly protective.
Perfect.
Once children become 6 months of age, that is when we can start using sunscreen. And sunscreen can be used from 6 months all the way through remainder of life.
Okay.
So I recommend anywhere between an SPF of 30 to 50 for sunscreen.
Okay.
That doesn't matter the lotions or the sprays. They're essentially the same sun protective factor elements. The biggest thing is the most important sunscreen and the best sunscreen is the one that you're going to apply.
Okay.
So find what works best for your skin.
So it doesn't matter if it's a cream or a spray as long as you're using it.
Exactly.
And you're using it frequently. I think a lot of us just want to put it on at the beginning of the day and call it a wrap, but that's not how you're supposed to use it, right?
Right.
Yeah.
So there is no such thing as a waterproof sunscreen, okay, when we
Even if they say so?
Exactly. When we perspire, okay, we change how that topical lays on the skin.
Okay.
When we swim, when we're doing water activities, we change how that topical lays on, right?
Okay.
Imagine showering, right? You
Right.
were able to take it off.
Right.
So reapplying is going to be essential. So general recommendations is reapplying every 2 hours. For some more fair-skinned individuals, it might be a little sooner than that.
Wow.
So just pay attention to those things, especially as an adult, your skin, the way your skin reacts.
Yes, yes.
So just be aware of that, and sometimes you have to limit that hour interval down a little bit.
Makes sense. So what are some of the signs of heat exhaustion or heat stroke? And then also, how can we prevent them?
For sure. So heat exhaustion is a time frame where your body is no longer able to cool itself effectively. Now, what that means is your body temperature ends up somewhere between 101 and 104 degrees. So, thinking about those numbers, that's like fever-like temperatures,
Of course,
right?
yes.
So when your body gets to that level and it is unable to cool, things that might happen are you could feel nauseated, you could feel wobbly, your gait could change. Somebody may complain of lightheadedness or dizziness, or I just need to sit down, I don't feel quite myself.
Right, yes.
I might feel some palpitations, my heart rate might be going. Those are all signs of heat exhaustion. So that's important for adults to know. That's important for adults supervising children if children are complaining of those types of things.
All right.
Now, if somebody is to develop those symptoms, it's important to know what to do. So again, cool liquids, getting them out of the sun, getting into a shady spot or even a cool place would be best. Then some things that I like to suggest are cool compresses.
Okay.
In our neck, we have our carotid arteries. We can put cool packs around the neck. That carotid artery is close to the surface of the skin. We can cool the body down. Those same arteries are in our armpit area and also in our groin. So if somebody is very, very sick appearing like that, those would be ways that you can help cool them down and help treat the early signs of heat exhaustion.
Okay, and before I let you go, I want to ask you too about summer bugs. They can be a nuisance. Some of them though, like ticks and mosquitoes, can also carry disease. So how do we avoid bites? That's one. And also, how do we know when to seek medical attention?
Great question. So as far as mosquitoes and such, Fortunately, we don't have high levels in the Maryland area of a lot of mosquito-related illness. Now, tick-borne illness is something that's very common here in the Mid-Atlantic region, and particularly in Maryland. So, first and foremost, when you're walking or you're spending time outside, be conscious. Tall grasses, places like the woods, places where animals are present, they're very, very common sites for ticks. Okay? So ticks can latch on. Ticks can transmit illness, particularly Lyme, when we're thinking about deer ticks in this region. So you should always be checking your body at the conclusion of a day outside. Great time to do that in the shower.
Yes.
And making sure if you see a tick bite and you can identify it or you're not sure, you should contact your provider. We can give you advice.
So that's the moment, is when you're seeing it, you're not sure, contact your provider. And one more question before we let you go. Tips for people who are going to the pool, beach, lake. We want to have fun in the water, but we want to be safe about it.
Absolutely. So for children, if we're supervising children, it's really important that to keep what's called like a buddy system, So if somebody's in the water, making sure they have a buddy or they're not alone. Number two, if adults are watching, you should trade off, adult or guardian, you guys should switch off. It's a long time to watch somebody in the water.
And be attentive.
Exactly.
Yes.
So switch off, keep extra eyes, 4, 6 eyes on kids, that's even better.
Perfect, all right.
And for adults, remember that when we're in places like the ocean, rip currents are very strong, Even the strongest adult swimmer can get into a safety situation. So be conscious if you're going to the beach where currents are present about water safety for adults too.
All right, and give us that website where we can find out more.
Absolutely. So to find a primary care provider or our team, it's gbmc.org/mydoctor. In addition, the American Academy of Dermatology has a lot of recommendations for skin care, and they're great educational resources for families.
All right, Christopher Toth, thank you so much for being with us. We appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.